center. So we are going to discuss with them how to handle colors, if there are therapies they will offer. And then the center, the head teacher told us about people coming to India. And then we had heard about it because people are coming to Neurogen. Even Neurogen had come to Uganda. They had like a meeting, like a conference at Hotel Africana. They told us whatever they were doing, they got videos. So we didn't know about Stemmerix. We had only known of Neurogen because it's, and even in the newspaper, they had written of people speaking after the stem cell. You know, I don't know if it was marketing or if it was reality, but that was the experience we had in Uganda. Like Neurogen, actually everybody knows most people. So most people go there. So for us, when we heard of, but then we also had the other side of failure about Neurogen, because we have some people who have done it, but then regression, like there was some discouragements, you know, you don't just question and it doesn't work. So mixed feeling.
Mixed feeling.
Some it works, others it doesn't work. Different testimonies. It didn't work for me. It worked for me. You know, such kind of confusion. But there were videos of people who have succeeded with Stemmerix, but most especially CP, I would say, because there are CP children, to see them active, swimming. So we said maybe we could try Stemmerix, because at least it's something that is visible. Yeah. So we said, let's go with Stemmerix, and then that's when we contacted you. And the response was good, you know. And that's how we made a decision to come. But there's still confusion back at home. There's still confusion of whether to do stem cell or to do therapy, intensive therapy. Because somehow the success rate of stem cell has not really been like 90%. So that is the challenge we have. So people say instead of you going there, rather find a maybe in Europe, like a center with intensive therapy. So we still have a big problem. We don't know.
Exactly what works like.
Yeah?
Exactly what works like.
Yeah.
In fact, one has to keep in mind, it's a holistic approach. Always remember.
Yeah.
Alone cells will not work. The cells need a continuous stimulation. We have to use a comprehensive treatment of magnetic stimulation, the way we use for him, like oxygen therapy we use for him, like electrical stimulations we use him, like, and then various therapies in different phases of speech therapies or behavioral therapies, and then the role of stem cell comes in, like. If you see, as we generate the treatment for 30 days, from first weekend itself we'll start getting small changes, not big changes, but the small changes we can start at the end of first week. And gradually toward the end on, significant changes we can notice in the child. Maybe not all the factors, but some of the factors you will find. This is the protocol which is designed, which called as sandwich, and which we get definitive results. Probably both of you will appreciate those changes which might have noticed it like.
Yes, we have noticed change. That is for a fact. We don't know to what extent. Whether it is 100, whether
that
it is
will
90,
come with the time factor. We'll
but
get
there is change.
There is some slight
change has come.
But then,
This change is what we see to begin with, which is I promise for the things like. Before, I always say, before you go from me, you will see the changes.
yeah, at least.
That changes are very important for you to know.
And it is there. But I still have questions in my mind whether how to proceed from
Now
here.
the therapies what we have given with you, you have to continue for 3 months continuously. I have given you CDs, I have given you write-ups, I have given you even everyone, you can give a video conference call with me to discuss about the progress. That is the most important thing which you can follow with me. And the second most important thing, after 3 months we have a evaluation where we know exactly the progress which is going up is constantly going up or has become steady. If it becomes steady, then we enter a small treatment again once more for 10 days or 15 days. So as to push him to bring to the state where we want him to call ADL, activities for daily living. He should understand, our target is he should understand, he should take self-care, he should express the feelings, he should know social behavior, he should speak required things. All those things are expected. We should bring up to that level and then stop the treatment. And I'm expecting Carlos will go to that level.
Okay. Then how about the issue of treatment like medicine?
Medicines, we are already given some tonics to you which you can continue. With calcium
I've seen there
preparations and those.
some tablets that
That
control
you just
hyperactivity.
continue, that's all. Not much.
Not much. Okay. Because he tends to be hyper in charge, very hyper, shouting.
Earlier one. Earlier one, no?
When there is a crowd,
With the crowd, they get afraid. Make it always a point. Don't suddenly take children to the crowd because they get disturbed. From the fear comes in. So gradually you have to develop that habit to them. That's the thing, gradually. The way now he is adapted. Initially he was difficult to do, but he's adapted now here.
Yeah.
So he mixes up with
It's
everyone.
handling everyone hands, but we have to see that hyperactivity. I think
It's
has
just
to be-
compared to that earlier on, it is little less now, but still more go less down. Put him in the regular school. Don't put him in special school.
Yeah.
And you have to be in touch with the team. Whenever comes in, you can give a call to the way the other patients keep in touch with me. You have to be in touch with us constantly. Okay?
That's fine.
In oxygen therapy, we can't find magnetic
In
stimulation.
Uganda
we
will
can't
not work.
find-
In Uganda, we don't find it.
Those therapies. No, many of the places, most of the countries they don't have. Most of the developed countries also they don't have under one roof. It is the therapy which we have developed it
The
here.
therapy. Fine, yeah.
So 1 year, 2 years, 3 years, you should plan to get us.
Definitely, if we get the permissions, we'll start a
But
center
now,
there.
doctor, I also want you to ask you, where do you see the stem RX, this stem cell? Like, do you intend to make it more effective?
Yes. You want to see that?
You are doing more research.
More research on that.
Yeah, because really if it comes up,
Because
so many people...
you might have noticed what treatment I had given earlier to the children. Now the children are getting still more better treatment. More better treatment.
Yeah, because it's a big challenge everywhere.
It's a challenge. Huh?
So,
Autism, I don't know where it came from, but it's in Uganda.
It's a big challenge.
Yeah.
It's a big challenge.
and worldwide, even in US, there are so many.
So many others.
So you have
Now
to do a
during this
lot
course
of
you
work.
saw one other child was from US was there.
We have relatives in the US. They tell us the stories. So many autistic children, only like therapy.
Now I would say rather you should become the ambassador to correct the life of those children and make happiness in their parents' life, those families. Chino, all the best. Have a safe flight. Enjoy the journey.
Thank you.
But
Go with
then
the
also,
wonderful
doctor,
memories.
you need also to start reducing for us the costs.
I believe I always consider that part. I cannot deny that.
So many Londoners are coming, but there is no man. So
I always
We are still third world.
you have to
still I consider
do
that.
more research, then reduce
We
the
will,
costs.
we will read it. Okay?
But this is for Carlos Emily.
Thank you so much, doctor. Perhaps we'll come back. Let's see how
All the
things
best.
fare.
Yeah.